What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. Two important questions that we have to ask ourselves from time to time include, what does our body need, and are we actually meeting our body's needs? From a wellness standpoint, this has been talked about. Common things include sleep, nutrition, mindfulness, things like that. But from a rehabilitation standpoint, I think that this is a really good question. When I think about what people tend to work on when they are uninjured, most people tend to focus in terms of exercise on their cardio and their strength. The third option is they don't really focus on anything at all. They just kind of do their day-to-day stuff without any specific intention, which is fine as long as they don't have symptoms. So when I talk with patients, I really try to understand their line of thinking when it comes to exercise and their goals. A good example, I had a patient the other day where I said I think that they would benefit from doing some physical therapy, and their response was, well, I'm actually very physically active. I don't ever really sit down, and I exercise, and I feel fine. Therefore, they did not think that they needed any physical therapy assistance. Now, I didn't really dive into, have they ever had physical therapy before? I just kind of listened to what they had to say. Now, I'm seeing them primarily because they have pain symptoms. So I recommended a treatment, and their response was, I move, I exercise in my own way. And from a movement standpoint, I guess they did not really see any benefit. I guess I can only assume that they did not see any superficial benefit of going to a physical therapist. I mean, obviously, there might be other reasons why they answered that way, why they didn't see any specific benefit, but let's assume it wasn't a financial issue and it was purely, just their own internal assessment. It wasn't what they actually needed. Maybe that's their conclusion. They believe that their body does not need a certain thing, in this example, physical therapy, because they are currently able to move their body sufficiently despite having pain, and that they move so much that they did not see any benefit, right? Let's say that was their own conclusion. So it got me wondering, well, that's true. They are able to do everything that they need to do. They can work, sleep, play. The main issue is pain. It made me wonder, well, is physical therapy what they actually need? One step past that, I should ask, what does the body actually need? Oftentimes when I'm dealing with pain symptoms, I'm trying to get people moving again. That's my primary goal. What I believe is that people's bodies, even in a painful state, they need to find a way to keep moving. That is the primary goal. We know that bodies that move tend to generally be healthy. And I don't mean just from like moving from the couch to the bathroom. I mean, they have the physical ability to run, move short distances, walk fast, climb, and squat. These skills are very basic but extremely important, especially the older that we get. When someone is in pain, they will often lose these skills, even if they were doing it prior to the onset of symptoms. And so that is something that I believe a painful body needs, is to find a way to continue moving in order to not lose these skills. I should probably frame this from a physical standpoint. Let's just say when someone is rehabilitating, they need sleep, they need proper nutrition. However, what are their physical or movement requirements for the body in a painful state? Sometimes a painful body needs to learn a way to create mobility. And the term mobility, I guess as a side note, is quite vague, but it is quite popular in the therapy and fitness space. I think when people talk about mobility, they generally envision flexibility in terms of like how well they can touch their toes and how well they can bend backwards, things like that. When I mention mobility in the clinic, people, will kind of reflexively touch their toes and just demonstrate to me that they can move. And they just assume that they're good. Or they'll say, I did gymnastics when I was younger. I'm more flexible than people think. So they just generally assume that they're fine. However, mobility is, in my opinion, is not purely a flexibility thing. It's not one of those physical attributes that just sticks with us with time without actually training it. People that are very mobile or have mobility are not necessarily flexible. People that are mobile have the ability to put their body in the position to support the activity or movement that they're trying to accomplish. Let's say you're trying to lift 50 pounds over your head. Person A, let's say, doesn't have the use of their leg. Let's say that they, are a wheelchair user, but, we give them the physical task of lifting 50 pounds over their head. And versus another person who is not a wheelchair user, does not use any assistive devices, and we have them lift 50 pounds over their head. Now, does each person lift 50 pounds over their head the same way? Like, they both physically can do it, but do they accomplish this goal differently? And from that standpoint, this is how I envision mobility in my head. I would suspect that they create this ability in different ways because of the way that their lower body moves. And when you're trying to lift something overhead, you have to recruit available muscles, joints, and orient them in the right place. This to me is, I guess, a very simple example of mobility. And it demonstrates the point that the goal can be accomplished, but you can get there in different ways. So this is kind of a movement strategy. When someone is in pain, let's say that they're used to moving in pattern A, but what they really need to do during the rehabilitation period is move like pattern B. I'll give you another example. I had a patient the other day where their primary complaint was back pain. They had an x-ray, they had an MRI, all of which was relatively negative. And as I was reading their clinic notes, it says that the patient declined physical therapy for the back. However, they did elect to do an injection, which was denied by insurance. But their bigger concern was that they are heading into their fourth shoulder surgery. And they were concerned about what are they going to do with their back heading into a fourth shoulder surgery. So when I saw that, I was like, well, there you go. This is someone who clearly loves weightlifting, which again is great. But they are now heading into their fourth surgery for their shoulder, trying to do the same physical task that they have been. So now extending that to their back pain symptoms, what are the chances that this person worked on any physical attribute aside from strength on their shoulders? And I'm talking about other attributes, including balance, proprioception, mobility, training with shoes, training without shoes. If they are heading into their fourth surgery for their shoulder, I wonder if their mobility pattern had ever changed, if they had asked their body, what does my shoulder need? Because I would almost guarantee that they have a similar reservation when receiving treatment for their back. Obviously pain is a big issue. They opted for an injection, and they failed to see the benefit of anything else like therapy for their back. Again, it goes back to, what does my back need? What does my shoulder need? Am I meeting the needs that my shoulder and my back are requiring? Oftentimes, I find that people assume that as long as it doesn't hurt, I can just get back to what I'm doing, because what I've been doing is all that my body part ever has needed. And while I think that makes some sense, I guess in my mind, it doesn't, because it's like, well, if you're giving what your body needs, then why is it that you're hurting, right? I'm sure that it's like, well, I tore this, I tore that, but to me, that's a big question. But let's say if we make the pain go away and you go back to doing the exact same movement pattern or the exact same habits, what are the chances that the pain are going to come back? If you have been giving your body what it needs, then it was just a pain issue. Then when the pain went away and you went back to the same thing, how come it came back? So at least from my standpoint, using that type of logic, it doesn't make sense to me as a physician, but it does. But I understand that that's how a lot of patients kind of perceive their rehabilitation program. And so, I think this is a important topic, in terms of asking what our body actually requires. I think it's fairly nuanced, but I think that people would be quite surprised when they actually looked at everything. As a movement specialist, I think that there are probably 10 to 15 things that the body needs in order to stay out of painful patterns. So if you're as a patient, I challenge you guys to ask, what does your body need? If you can only really come up with maybe 3 to 5 things, you know, there's 10 other things that I could probably help you with. It's not always easy for people to accept that because again, it's just a pattern a pattern of thinking that people are used to. It's like, well, as long as I have strength and as long as there's no pain, the body will do the rest. It doesn't work that way. I challenge you guys to, think about what else does your body need? Does it need time? Does it need, stretching? Does it need working overall balance and proprioception? Does it actually respond to different types of movements and activities? Sometimes during the rehabilitation phase, that's how you actually get back to the thing that you love. So I know it's kind of a dense topic, but I think it's important for people to question what your body needs at any point in time. I'll use this last example. Let's say that you're a runner, and let's say you're a lifelong runner, and you run when you're 20 years old, no problem, right? Now if your goal is to keep running into your 70s, right? Let's say in your 40s, what are your body's needs? What are your body's needs in order to accomplish this goal of running into your 70s? Are these needs the exact same as what your body needed when you're 20? What about when you're 55 years old? So now we're talking 15 years after 40. Are your needs when you're 55 the same as when you were 20? Are your needs the same as when you were 40? To me, that's a helpful way to kind of frame your overall goals, your training regimen, your rehabilitation, to appropriately adjust your expectations. I think that's really, really important for people to think. I know that most people just assume that it's just a parts problem. Arthritis, tendinopathy, tendinitis, bursitis, things like that, but it's not. There are so many different other facets that should be addressed to help people over painful episodes, but also to keep people moving lifelong. So again, I challenge you guys, ask yourself, what is it that you think your body needs? If you can only think of 3 to 5 things, definitely, hit me up. We can talk about, other things that the body needs, at least from my experience. I do virtual visits if you are in the state of Virginia, and I'd be happy to talk with you guys about it. But either way, hit me up also on the social media. I'd love to have a bigger discussion. Thanks again. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.